This segment of DelmarvaLife is sponsored by TidalHealth.
You already know that November is Lung Cancer Awareness Month. You might remember that last week we discussed the surgical side of TidalHealth helping people tackle this illness.
But there are other aspects to care that are less about the physical treatment and more about the mental and emotional side of things. Here with us this afternoon is Kathy Stafford. She is the Outreach Manager with the Richard A. Henson Cancer Institute with TidalHealth. Welcome.
Thank you.
Good to have you. Thanks for coming.
Thanks for letting me come.
You betcha.
And for all the work that you guys do.
Absolutely. It's our pleasure.
I really appreciate it.
Well, first of all, give us an example and overview of the cancer support that's available.
We have a number of internal and external support services with TidalHealth. One being internally our social work team, who are all clinically available for our patients if they are in distress. We also have external support services like the MAC Center, Women Supporting Women, Unstoppable Joy. If I could go back to the internal support services, we also provide ways in which people can get physical help as well after they've received treatment to become stronger and more healthy, and also deal with the nutritional side of things. You know, if you eat well, you're going to do a much better job at recovering and also thriving during treatment.
So what about the emotional and psychological part?
Well, our team, I'm a little partial to them, our social work team, because I get to work with them on a daily basis. And they're some of the most kindest women that you can encounter, and they're there for every single one of the patients that come to them. They talk with the patient about how to deal with the idea that they actually have cancer and how to talk to their families about it.
Because that's huge.
Yeah, and especially this time of the year.
Oof.
Some people might not know that their family is suffering with something.
Yeah.
And their body's changing, you know, when they seek treatment and they're being treated. So all of those things, it's nice to have somebody to lean on, to talk to, and to address those concerns that they have.
Absolutely. So how does TidalHealth assure accessibility to the underserved and the rural communities?
I love that question. One of the most exciting things that we have coming our way is our mobile mammography unit. We're going to be able to drive to communities that are underserved with this mobile mammography and actually scan our patients that are in those hard to reach areas. I did a basic report last week. We have over 5,000 people we served last year, and out of the 5,000, over 20% travel 40 miles round trip for treatment. And so we have a beautiful Eastern Shore, but we are vast, and it's difficult sometimes for people to get to treatment. So some of the services that we provide for those that are seeking treatment is transportation even. And also food support, those kinds of things that those that don't have maybe the caregivers at home to take care of them, we can sometimes help them with that.
That's awesome. So let me ask you this. How does TidalHealth approach educating the public about early detection and just education in general?
Thank you for asking that question. And the reason, I have three major things I want to make sure that people know. One is that cancer treatment is standardized. So I have family members, and I'm sure you do too, that are affected by cancer. And we often want to travel to, you know, these wonderful hospitals on the other side of the bridge, but it causes all kinds of stress and anxiety. We can provide the maintenance locally. So if you have ABC cancer, right, you're going to be able to be treated here on the shore with that treatment because it's all standardized. If you have a specific type of cancer that we can't treat here, we have our wonderful oncologists who talk to Hopkins and Mercy to provide the best treatment. In addition to that, we also have clinical trials that are here on the shore to help us better understand what's causing the frequency of cancer here and how we can better address it in the future. The second thing I really want people to know is that if they have family members who have cancers, mothers, fathers, grandparents, it might be important for them to get tested and tested early And the reason for that is that we're noticing it's more genetically connected than we realized.
Yeah.
And so if they can get testing done early, it's going to help them in the long run. And then the third thing is about screening again, is just to talk with family and friends, be there for them, because they're not going to want to come for treatment if they don't have a support system.
Yeah. Kathy Stafford, thank you so much.
Thank you.
For sharing these most important points that we need to know.
Yeah, I appreciate it.
Wonderful talking to you.
Yeah.